So the symptom complex is painless progressive jaundice with palpable gallbladder. Second thing is, because the bile is not coming into the intestine, the stools which are yellow in color become white.
Oh, white
Yes.
stools.
They become white, actually white, creamish white. Because the color of the stool comes from the breakdown of the bile ka pigment. The yellow colored pigment which is in the bile, its breakdown products gives the yellow color to the stools.
You are watching Surgery Simplified. शस्त्रकला सरल शब्दों में.
Hello everyone, welcome back to our channel Surgery Simplified, शस्त्रकला सरल शब्दों में. मेरे साथ है डॉक्टर निखिल.
नमस्ते.
तो हम काफ़ी क्रॉनिक पेन के बारे में डिस्कस कर रहे हैं. हमने ऊपर से स्टार्ट किया, then we came to pancreas. तो अभी पैनक्रिया के बाद क्या होगा?
तो हमने एक्चुअली क्रॉनिक पेन में फूड पाइप का बात किया, स्टमक अल्सर्स का बात किया, उसके बाद गॉल स्टोन्स का बात किया, उसके बाद लिवर की कंडीशंस का बात किया, फिर क्रॉनिक पैंक्रेटाइटिस के बारे में बात किया. अब मैं दो कैंसर्स के बारे में बात करने वाला हूँ. ऑफ कोर्स बोथ आर नॉट वेरी कॉमन, बट दे जस्ट टू कवर द होल segment of pain which comes between the umbilicus and the xiphisternum, that is this part here and here, this part, pain in this part. We are talking mainly of pain in this part. So let us discuss about pancreatic cancer. The pancreatic cancer can happen in patients those who are having chronic pancreatitis. So for example, I told you about Kerala where the people get pancreatitis at a younger age, in the 25-35 age group. They then have time in their lifetime to get pancreatic cancer. That chronic pancreatitis, even if it is treated not by removal of pancreas but by other operations, like I told you, bypassing the stones, removing and then putting the intestine, where the pancreas is still there, that can go into cancer. Pancreatic cancers do not have any specific cause, except that existing pancreatitis can lead to that, and probably it might be that some form of genetic thing, because the genetics is involved in the pancreatitis, so indirectly it is involved in this. Now the pancreas is like an organ going from the right side to the left side. So it has got a head, a neck, a body and a tail. Okay, the head is intimately attached to the duodenum, and the duct enters from the pancreas into the duodenum, where the pancreatic juice comes into the duodenum, where the food comes from the stomach. The C shape, that is stomach, first part of duodenum, second part of duodenum and third part. So this second, third and fourth part of duodenum encircle the head of the pancreas. So we divide pancreatic cancers into two: those that happen in the body and tail, and those that happen in the neck and the head. Okay, there is a reason for that, because everything regarding the symptoms, the treatment plan and the vital structures which are involved are different in the two cases. Let us take the head and neck first, which is more common. The head and neck, as I already told you, is intimately related to the duodenum. Also, it just below the neck, the big vessels which come, the large vessels which supply the entire intestine, they pass under the neck of the pancreas. Okay, just under where the head ends and the body starts, the neck. Just below that, the large vessels from the aorta, they open and they are the two vessels known as the superior mesenteric artery and vein. They enter under the pancreas and they come and supply the entire upper intestine. Right? So, since it is so intimately attached to the vessels, if you do not diagnose the pancreatic cancer in time, it becomes inoperable, because if you remove, you may damage that blood vessel and it will cause gangrene of the entire intestine. So you cannot remove it. Second thing is that the head has the pancreatic duct, which is opening near the bile duct. So the cancer can spread there and block the bile duct and cause jaundice. Okay. So there are two vital structures which are very much attached or near to the head. That is the bile duct and the blood vessels which pass underneath and supply the intestine. Because of these two reasons, pancreatic surgery in the head and neck becomes more technically challenging and more chances that it may turn out to be inoperable on the table. When you open the table, you may find that you are not able to remove it because it is already stuck to the blood vessels, which is very difficult to prove even with good imaging. Nowadays, of course, imaging is very good, but still it may not be in every case that you are able to know whether the vessels are involved or not involved. So many times on table, once you are doing the operation and you find that the vessels are involved, you have to abandon the procedure. Okay. So this is regarding the pathology and the other things. Now, regarding the symptoms, I told you, if you remember, that when there is a stone in the bile duct, patients develop three symptoms: pain, jaundice and fever, called Charcot's triad, right? So they get pain, they get jaundice and they get fever. In this case, that means when there is a blockage of the bile duct, either because of cancer of the pancreas spreading into the bile duct, or it could be cancer of the lower end of the bile duct spreading into the pancreas. That is very difficult to prove. So we call it periampullary carcinoma. Ampulla is the area where the bile duct and the pancreatic duct come and open in the duodenum. So if this is the C-shaped duodenum, there is a ampulla. Ampulla means an area which is like a bulb-like area, matlab expanded area. In that both these ducts open through a common channel. So now if suppose there is a cancer of the bile duct, it can spread into the pancreatic duct and in the pancreas, or pancreatic cancer can spread into the bile duct. So it's difficult to say which of them it is. But the basic thing is both the ducts get blocked. Pancreatic duct also gets blocked, bile duct gets blocked. So when the bile duct gets blocked, bile cannot come, so patient gets jaundice, deep jaundice. Bilirubin, which normally is 1, can go to 20, 30, 40. Okay, so but the important thing is, because this is over a period of time, stone may, what happens, it comes and suddenly blocks because so it causes pain. Here what happens is that it is not completely blocked, it goes on becoming narrower, so the bile duct becomes dilated. And the gallbladder, where the bile is accumulating, can become so big. I have seen a gallbladder going right down to the lower part of the abdomen. It becomes like a big sac. Okay. So, painless progressive jaundice is a symptom of periampullary carcinoma or carcinoma of the head of the pancreas. Painless, there is no pain, but progressive jaundice goes on deepening is this. Whereas if it is pain with jaundice and fever, it is likely to be bile duct stone. Whereas if it is painless progressive jaundice, it can most likely be cancer of the pancreas. And you can actually feel the gallbladder, you can palpate it. So there is a law called Courvoisier's law. Courvoisier law, the person who detected that. What he said, if you can palpate the gallbladder, then it is not gallstone which is causing the blockage, it is cancer. In those days, it is in the 19th century, there was no imaging to know what is it. So person had jaundice. Now you wanted to know whether it is bile duct or whether it is cancer. So if you palpate the gallbladder, if you can palpate it, it is because of cancer. So the symptom complex is painless progressive jaundice with palpable gallbladder. Second thing is, because the bile is not coming into the intestine, the stools which are yellow in color become white.
Oh, white
yes.
stools.
They become white, actually white, creamish white, because the color of the stool comes from the breakdown of the bile ka pigment, the yellow colored pigment which is in the bile. its breakdown products gives the yellow color to the stools. So when the bile is not coming in the intestine, the stools become white, and the urine becomes like beer, color of beer or tea, that high colored. So high colored urine, pale colored stools with painless progressive jaundice is the clinical scenario of a cancer. Generally they do not cause pain, they call osseous, and they get itching also because of obstructive jaundice, right? So this is how you diagnose it. Now if obviously when you have to do MRCP, like in all other conditions where it is magnetic resonance cholangiopancreaticography, or you can do a contrast CT, or you can do an MRI and a PET CT to see whether it has spread elsewhere in the body before you decide about doing surgery. One more thing you need to do is do an endoscopy and take a piece from the, if you can see a growth there, for biopsy to prove it is pancreatic cancer. But if it is in the body or in the head of the pancreas, not visible from here, then it is difficult. It is difficult. But if it is periampullary, you can take a biopsy. But that is why this whole symptom complex becomes important. Plus loss of weight. Plus loss of weight. So with all this, you can plan a surgery which is called as Whipple's procedure, in which the lower end of the stomach, the entire duodenum, the head of the pancreas, the neck of the pancreas is removed in one chunk. And then the jejunum is brought up and then it is anastomosed to the bile duct and the stomach. So the lower end of the stomach, first part of duodenum, second part of duodenum, third part of duodenum is removed along with the head. And then the jejunum is brought up and anastomosed to the liver and the stomach. This is known as Whipple's procedure. For body and tail, the problem is they only present with pain and in late stage, because being at the back, when the cancer is growing, there are no symptoms unless you do by chance and some imaging like ultrasound or CT scan and you pick up something. But by and large, body and tail of pancreas usually are diagnosed late, after they start causing pain, when they infiltrate into the nerves. Okay, but in case you diagnose them early, you have to do the same procedure like for chronic pancreatitis, 95% pancreatectomy. Leaving this rim of pancreas, you remove the entire pancreas. And sometimes if it is nearer the tail, because the tail ends in the spleen, like this. Spleen is there, pancreas and duodenum. So you have to remove the spleen, because if it is very near to the spleen in the tail, then you have to remove the spleen. Because in cancer surgery, what you assume is, what you see with your eyes, it is one step ahead. That means if you see a tumor near to the spleen, you have to assume that microscopic spread is already there in the liver, in the spleen. So you have to remove it with the spleen. So you either remove the pancreas, but if it is in the middle of the body, you may only remove the pancreas, leave the spleen. Spleen, you know what is the spleen, right? It is a small liver which we discussed that it produces RBCs, destroys RBCs. Yeah. So the spleen is attached to the pancreas. So if you have to treat the pancreatic tail, you have to remove the spleen. If you are treating for body, you remove the pancreas. Okay? So this is the treatment. There is very little role of cancer pancreas with radiation or with chemotherapy. Very little. Basically it is surgery. So if you cannot remove the pancreatic cancer for whatever reason, then they do not survive. If you are able to treat them in the earlier stage, because these cancers, which are the periampullary cancers, they appear early because of the jaundice. So they have a little better prognosis than body and tail, only because they come late in life. Okay. So overall prognosis is around, in the sense, if you can treat the cancer by surgery, is around 45 to 55% 5-year survival. But otherwise nothing can be done. I mean, if it is spread, then you cannot do anything. You have to just treat the pain and things like that. Palliative treatment. You generally don't do surgery if the patient cannot be cured. Regarding the stomach cancer, very briefly, because the stomach is in front of the cancer, you get 3 or 4 types. You get a cauliflower-like growth, you get an ulcer, or you get what is called as a widespread cancer in the whole stomach. Okay, it is diagnosed by endoscopy, biopsy, and the treatment for stomach cancer is to remove the entire stomach with all the surrounding lymph nodes areas.
The entire stomach.
Yeah, the whole stomach is to be removed, and then you join the intestine to the food pipe.
Oh.
Yes, but it is quite rare now. In once upon a time, it was very common cancer and common cause for death. But nowadays, stomach, because all these acidity controlling medicines have come and everything, so the chances of the cancer happening in stomach has become less. And because of better hygiene, the food we eat is better cooked and better prepared, and so on and so forth. Stomach cancers have become very less common, but they do occur, and their presentation is pain in the abdomen, just like a gastric ulcer, stomach ulcer. I told you while we were discussing that if the ulcer doesn't heal after giving omeprazole, you need to biopsy it, and then you can prove that it is a cancer and treat it with surgery.
Okay. All right. So, dear friends, this was all about pancreatic cancer and stomach cancer. So, if you have any queries regarding these two discussions, let us know in the comment section. Do share this video with your friends and family. Subscribe to our channel and stay tuned for more episodes. Thank you.